All right, so this is the CPR basic life support module. So we'll probably go through like the AES part, and then we'll start doing like the going through the videos and stuff. The only thing with another thing about BLS and stuff, like you have to buy, like I had to buy like my own videos. They used to be you could get them on a flash drive or like regular DVDs. Now it's just a website, and I just put it on here and I pull it up, so which is convenient because I can pull it up anywhere. All right.
Marcus is at the local high school football game. He's watching his grandson play football with his family. Marcus has had a long day. He supervises several construction sites. He's been on his feet all day. He had to solve a lot of issues at the site. He barely made it to the start of the game. It's halftime now. It's a close game against their crosstown rivals. Marcus is not feeling well, and for the past week, he's been having some chest pains and at times has been short of breath. He starts to leave the crowded stands to get some air. On his way out, he collapses in front of you. What should you do?
What would y'all do? Somebody collect for y'all. Not scream, not run.
So everybody get out the way.
I would check their pulse first.
It's something you should do first though before you check their pulse.
I said everybody get out the way.
You what?
Say everyone to move away from him.
You gotta secure the scene first. You know what that means?
Look around.
You looking around because why?
There might be people around.
It might be like an emergency.
It might be something bad that's gonna put you in danger. So you don't want to walk. Like you don't want to walk.
I thought like somebody end up fighting over there by you.
They could be fighting. Somebody could have a gun. It could be
But that's basically what I just said. Like move people away from you or tell them to get away.
Well, you ain't really got no move on, but you just want to make sure you're not walking into something that's gonna make you a patient too, and both of y'all is on the ground. Like if somebody got a gun, he could have been somebody shot him or something, and you just see somebody fall, you don't know what's going on, so you kind of got to check the scene to make sure you're not walking into anything. Now this is just like if you're out in the field, you know what I'm saying, in the hospital. I mean, people do walk into hospitals and shoot and all kinds of stuff, so you could do that too. You could look around, but mostly like if you're out somewhere, somebody, collapses or something. Oh, this thing works when it wants to and it don't.
Is Marcus having a heart attack? Heart attacks occur when the blood flow to the heart is blocked, causing part of the heart tissue to die. A heart attack is also referred to as a myocardial infarction. Heart attacks can be quite serious and even fatal, but many times they are minor and even go unreported by the victims. Victims that are suffering heart attacks have crushing chest pain. They feel pain in other areas of their upper body, such as the left arm and shoulder, jaw, and neck. Shortness of breath is also common. Other signs include dizziness, nausea, and even vomiting. However, victims of a heart attack usually do not collapse like Marcus did.
All right, so sometimes like with chest pain, with symptoms of a heart attack, women are more times than men, they won't have like severe crushing chest pain, all this stuff. Like it's women that, don't know they're having a heart attack. Could be some men that don't know, but most time women don't have all those like telltale signs that you'll think of. But anytime you got chest pain, shortness of breath together, or anything like that, you need to make sure that you go and get checked out. Cause like if y'all been to emergency rooms before, you have to wait.
Yeah.
So if they do it they triage you. So what triage means is they're putting the people with the most priority ahead of you. Cause people always complain about going to the emergency room and I had to wait, but that's because they're triaging you. So if somebody comes in more severe, you're gonna get bumped down. That's why I say if it's a toothache or something, go to the doctor. Just call the doctor because you're gonna be in there and keep getting bumped. People come to the ER for the most crazy things sometimes. Sometimes it's warranted, but like chest pain is gonna go first. It's gonna be your top priority. Shortness of breath. If you're on the ambulance, oh, you're gonna get seen first because you know that's an emergency. But you know that's how it works. They're gonna triage you to see what your symptoms are and all this stuff, and then they're gonna put it in like levels of priority. So I think some people don't understand that's how it works. Then you have enough of your life. Yes, you did. I had enough of you. Goodbye.
Marcus has just suffered a cardiac arrest. The term heart attack is often mistakenly used to describe cardiac arrest. While a heart attack is serious and can eventually lead to a cardiac arrest, the two are not the same. A cardiac arrest is much more serious. If we look at the individual words, we find that cardiac means related to the heart, and arrest means stoppage. So, simply put, cardiac arrest means heart stoppage. More precisely, a cardiac arrest is when the heart stops effectively pumping blood through the body. A cardiac arrest occurs suddenly and often without warning. However, about 50% of the victims do have symptoms, such as chest pains and shortness of breath, as much as a month prior to the event.
Alright, so cardiac arrest is when the heart stops, completely pumping. Like, your heart is like a pump. It pumps in and out. That's your heartbeat. And when it stops, that is cardiac arrest. Some people it's like sudden. Some people, you might have some symptoms before your heart just stops. So cardiac arrest is what we're gonna treat. We're gonna try to use CPR to treat. Which is more serious, a heart attack or cardiac arrest? Cardiac arrest, right? Because your heart is stopping, it's arresting.
What is causing Marcus's cardiac arrest? There are many causes that can trigger a cardiac arrest, such as choking, drug overdose, severe trauma, electrocution, respiratory shock, and a heart condition or disease. It is this last category of causes that can result in a cardiac arrest occurring seemingly out of nowhere, like Marcus's. This type of cardiac arrest is referred to as a sudden cardiac arrest. Marcus's long-term heart condition has caused his sudden cardiac arrest.
And because Marcus collapsed, and they're thinking that it's sudden, and he has a history of heart problems.
The heart has an electrical system that controls how it beats. An electrical signal causes the muscles in the bottom chambers of the heart, or ventricles, to contract and beat. This results in blood being pumped through the body. Problems with the heart's electrical system can cause arrhythmias. Arrhythmias are changes in the heartbeat's normal rhythm. An arrhythmia causes the heart to either beat too fast, too slow, or in an irregular rhythm. Most arrhythmias are harmless. However, some issues are serious and can cause the heart to stop effectively pumping blood through the body, thus leading to a cardiac arrest. Common arrhythmias related to cardiac arrest are ventricular fibrillation, or VF for short, and pulseless ventricular tachycardia, or PVT. As the name suggests, VF and PVT are arrhythmias related to the ventricles. Arrhythmias are not the only problem with the heart's electrical system that cause cardiac arrests. For example, pulseless electrical activity, or PEA, is a condition where the heart's electrical signal does not produce a beat, thus leading to a cardiac arrest.
Alright, so when your heart beats normally, that is, when we'll talk about that when we talk about EKG, is a normal sinus rhythm. That means your heart has a nice beat, it has a nice rhythm, everything looks good. An arrhythmia is when it's not normal. That means it's abnormal. So that's when your heartbeat, your regular nice heartbeat changes. So things that can come from cardiac arrest is if your heart goes into something called ventricular fibrillation or VFib. Then you have something called VTach or pulseless, meaning you don't have a pulse with VTach. VTach, tachycardia, remember, cardi means heart, tachy means, y'all remember? what tachy means?
No.
Y'all remember what? Y'all remember tachycardia, bradycardia?
No.
Tachypnea, bradypnea? Nope, nothing.
Mm-mm.
So tachy means fast, heart. So that means you have an increased heart rate. Bradycardia means it's slow heart rate. So this means that your heart, ventricular, and the ventricles, your heartbeat is going too fast. Remember, heartbeat is 80 to 100 beats per minute, so it's going too fast and it doesn't have a pulse rate. So if you have a heartbeat, if you touch your wrist where your artery is, or your neck where your carotid artery is, you won't feel a heartbeat. Well, this heartbeat, this abnormal rhythm is going to be fast, but you won't have a pulse. So normally if you feel where your arteries are, you gonna feel something. Well, this one will have a fast heartbeat with no pulse. That's what it means with pulseless. You won't feel anything. So these two, because it's ventricular fibrillation and ventricular tachycardia, they're gonna happen in the ventricles of the heart. Remember, we got the ventricles in the atrium of the heart. That's where these gonna go. All right, what heart issue can cause cardiac arrest? Is it circulation, valve, size, or electrical? Huh? Alright, it's electrical issues can cause cardiac arrest.
But I thought it was the first one.
It's kind of like the electricity of your heart's kind of like has to,
So where's the electricity coming from?
like the beating of your heart. You remember your beating of your heart moves like blood. We talked about the cardiovascular system. That's the thing that keeps everything going in your heart.
Oh, it is?
Yeah, your heart and your lungs work together. What is an abnormal heart rhythm that makes the heart unable to pump blood effectively?
Is it the V one?
It's an abnormal heart rhythm. You said it's the B word?
I thought it was. But you said it was A, didn't you? Huh?
We know that ventricular fibrillation is abnormal.
Yeah.
Arrhythmia is an abnormal heart rhythm.
So they said abnormal heart rhythm.
That
So it
makes
might
the
be the
heart
A
able
one.
to pump blood effectively.
Oh, I was wondering.
Right, ventricular fibrillation is an arrhythmia because it's not normal. Remember, you have a normal rhythm, but if it's an arrhythmia, that means it's abnormal. So ventricular fibrillation is a type of abnormal heart rate, so that's an arrhythmia.
How serious is this for Marcus? Marcus has stopped breathing, and his heart is not pumping blood through his body. This is known as clinical death. In the medical field, there are two types of death, clinical and biological. Clinical death is when breathing and blood circulation stop. These are two conditions needed to sustain life. During clinical death, most organs remain functional. Clinical death can be reversed. Biological death is when organs, especially vital organs such as the brain, die and can no longer function or be revived. Biological death occurs shortly after clinical death. Marcus is clinically dead.
Clinical death can be reversed. That's when breathing and blood circulation stop. Alright, so clinical death is when the breathing and the blood circulation stops. So remember, I just said that lungs and your heart work together. So that's what that means, breathing and blood. So your heart has to pump in order for your blood to move. Your heart has to pump. So remember, your blood goes through different parts of the body. So biological death is when organs can no longer function or be revived. So if you got somebody, that's why it's important. If you know CPR, somebody collapses, the quicker you start chest compressions, the better their survival is. Because if they're clinically dead for too long, that means that everything else is gonna start shutting down. So your brain, all other organs will start shutting down. So Sometimes when we have, when I worked in the emergency room or we worked in the hospital period, we have people that come in, well, they come in on the ambulance, they cardiac arrest at home, they call 911 when nobody did anything. That's why I'm a big proponent for people learning CPR, because if you don't do anything, the outcome's probably gonna be bad. If you at least start chest compressions, then they have a better chance of survival. Is it gonna always help? No, but you can try. So that's what they're saying, clinical death can be reversed, because they got medicine they can give and CPR. So that's what we're trying to stop. We're trying to stop them from going to biological death. That's why when people they do when people have been like comatose or unresponsive for so long, sometimes they're on a ventilator, they'll do a it's called a breathing trial, and they'll take some oxygen, disconnect it from the ventilator, they'll put the oxygen down the tube, and they'll see if anything happens, and they'll take blood and all that stuff while this is going on. They're trying to determine if the brain has any activity, and that's how sometimes they'll determine that their brain dead. Because from what they do when they're disconnected, because your brain, everything works together. So your brain, even though we don't think about breathing, your brain is telling you to breathe. We don't sit here and think, okay, take a breath. No, because it's like automatic. So you would think if you disconnect somebody from a ventilator, but if they're so far gone, like biologically dead, they're not gonna breathe because everything is shut down. So that's how, like, we got patients or family members that don't want to take their family member off the ventilator. And then we have to come in, and like the ethics committee, and everybody comes in and gets involved because they just want to hold on to grandma. Grandma is dead, but they just can't come to terms with it. Then sometimes they have to step in and do things to show them, okay, this is what this means. She's not reacting. She's no longer here. Just the machine or the medicine is the only thing that's keeping her alive. So that's why some people don't want that. When they'll tell you, like, family members, like, well, don't have me on them hooked up to machines, because they don't want that. Because it's not really a way to live. You can't do anything, you just lay it up in there.
The main function of the heart is to pump blood through the body and supply it with oxygen. During a cardiac arrest, the heart can no longer pump blood. This has very serious consequences to vital organs, such as the brain. Within 20 seconds of a cardiac arrest, the victim loses consciousness due to lack of oxygen to the brain. After about 1 minute, brain cells or neurons start to die. After about 3 minutes, neurons begin to suffer more widespread damage. After 4 minutes, lasting brain damage is likely. After 6 minutes, biological death becomes imminent. After 10 minutes, a coma and lasting brain damage is almost inevitable. Shortly after that, survival is nearly impossible. As you can see, a cardiac arrest is a very serious condition. This is not good for Marcus or his family.
So that's why we're saying, like, if you do witness a cardiac arrest, you're CPR certified, or BLS certified, or whatever, and you assess the situation, they don't have a pulse, you can start doing chest compressions. You don't have to do mouth to mouth. As long as you're doing chest compressions on that person, you're trying to get their heart pumping so that the blood will start flowing back, and then you won't have like brain death and all these things. Because after about 4 minutes, you're starting to go into having brain death. So you don't want that, without anything happening. So they just go into cardiac arrest and they're just laying there. And that's how people that, are home alone and they might have suffer like a massive heart attack. Well, nobody's there to do anything. So there's really not no, way they're going to survive it. Because nobody is, trying to restart their heart. That's the purpose of CPR and chest compression, trying to restart the heart so that it goes into a normal rhythm.
Time is critical for Marcus. Quick action is needed. While Marcus is clinically dead, there is still a chance that he can be revived. Marcus's chances of survival can be increased if he receives basic life support. Basic life support, or BLS, generally refers to a level of emergency medical care given to victims of cardiac arrest, respiratory distress, or an obstructed airway. In this module, you'll learn BLS methods and techniques that someday could save a life.
Alright, so we're gonna learn about what to do if somebody goes into cardiac arrest, if they're respiratory distress. So if they have a heartbeat but aren't breathing, you do something different. However, if they go not breathing for so long, the heart is probably gonna start slowing down. Because remember, they work together. The heartbeat, your heart, your circulatory system, and your respiratory system work together. And then if you have somebody that's choking and has an obstructed airway, you'll do the Heimlich maneuver, so you'll learn that and all that stuff. But all of it kind of is what you'll learn with basic life skills.
In this lesson, you learned about cardiac arrest, the difference between a heart attack and cardiac arrest, causes of a cardiac arrest, what happens to the heart during a cardiac arrest, about VF, PVT, and PEA, the speed of damage caused by a cardiac arrest, and how BLS can help during a cardiac arrest. During this lesson, you will learn about cardiac arrests in the United States, understand the goal of the American Heart Association concerning cardiac arrests, identify the chain of survival and the basic life support links in the chain, learn the basic steps of CPR, learn how CPR and defibrillation help cardiac arrest victims, understand defibrillation and shockable rhythms, recognize when not to start and when to stop BLS, and learn about BLS certifications.
Alright, so like I said, we'll start CPR. Y'all will learn all the different steps so that you can get your CPR certification and get your card.
A cardiac arrest can be sudden and unexpected. It can happen anywhere, at home, at work, at a sporting event, even in a hospital. Cardiac arrests are most common among older men, but they can happen to anyone, females, young adults, and even children, and they can happen to any race, white, black, Latino, or Asian. Cardiac arrests are a leading cause of deaths in the United States.
Alright, so cardiac arrest is one of the leading cause of death in the United States, and it doesn't discriminate. You can be young, old, you can be black, white, you can be Hispanic. It doesn't matter. Like, it doesn't discriminate. Some people are born with heart problems. Some people develop them later on in life. So you never know. But it's important to learn about BLS CPR so that you can possibly help. When you have a situation like this.
According to the American Heart Association, or AHA, there are about 560,000 cardiac arrest cases in the United States every year. Just over 350,000 of those cases are out-of-hospital cardiac arrests, or OHCA. The other approximately 210,000 cases are in-hospital cardiac arrests, or IHCA. A victim's chance of survival decreases by 10% for every minute that passes after the cardiac arrest. That means that after about 10 minutes, if the victim is not resuscitated, there is almost no chance of survival. Of the roughly 350,000 OHCA cases, there is only about a 10% chance of survival to discharge from the hospital. For the 210,000 IHCA cases, the chance of survival to discharge is not much better, about 21%. The combined chance of survival is about 14%. Those are not very good odds. This means about 470,000 victims of cardiac arrest die each year in the United States. Can we do better?
So that's why it's important to know CPR and learn it, know how to do it correctly, because like they say, a victim's chance of survival decreases 10% for every minute that passes after the cardiac arrest has started. So, like when they said 4 minutes, you can be brain dead after 4 minutes. So, that is just, that's like 40% right there. So that's why it's important to know how to do it, because you could be somebody that, can help save a life.
The AHA, a nonprofit organization, is a world leader in the science, education, and training of CPR and emergency cardiovascular care. One of their goals is to improve the outcomes of cardiac arrest victims. Their long-range wish, of course, is to have 0 deaths resulting from cardiac arrests. However, for this to occur, more practical intermediate goals are attempted. For example, between 2010 and 2020, it was their goal to increase survivability from about 8% to 15%. Quite a challenge. Any goal can only be reached through the constant improvement in treatments, processes, and education related to cardiac arrest. Remember, every 1% increase in the survival rate translates to almost 5,000 saved lives in the United States. Chain of survival. The AHA defines an integrated set of actions to provide the best chances for survival and recovery after a cardiac arrest. The AHA refers to these actions as a chain of survival. Each link in the chain must be strong for the whole chain to be effective and increase the chance of survival. Depending on a situation, in hospital or out of hospital, adult or pediatric, a different version of the chain of survival may apply. The links include early recognition and prevention, activating the emergency response system, high-quality CPR, defibrillation, advanced resuscitation, post-cardiac arrest care, and recovery.
Alright, so when we're talking about cardiac arrest, and we're talking about CPR and how to treat it. So you have the chain of survival. So these are the things that you gotta do in order to help somebody's chances of, living. So you gotta know early recognition and prevention. So you got to know like what you need to look for. Activation of emergency response system. So in the hospital, it's a lot easier because on the walls, they just have a button that you press and everybody just shows up. It'll start blaring, code blue, or maybe it just depends on what hospital you work at. Our beepers just all go off at the same time, so that's when we knew something was happening. We just hear a bunch of beepers going off. Some places they call it overhead, so everybody shows up. And then you got to perform high quality CPR. You also use your AED, or we call it a crash cart, which is that cart that's over there near the bed, and it has like a defibrillator on it. Then the things that you have to do after you revive them, so post cardiac arrest care. So if you get their heartbeat back, then what other things you have to do, and then their recovery. So out of hospital, that means if you're somewhere at the mall, at church, at a sporting event, and somebody goes into cardiac arrest, and you can be one of the people that helps. So you'll activate the emergency response system. That could be somebody else calling, or you just pulling out your cell phone, putting it on speaker while you attempt to start CPR. Give high quality CPR. Also using the AED, making sure that the EMS, so that's advanced resuscitation, EMS, first responders get there, post cardiac arrest care once they're at the facility, and recovery.
The chains of survival are integral in basic life support, or BLS. There are slight differences in the chain of survival based on the age of the victim and the location of the cardiac arrest. The common steps among all 4 are early recognition, high-quality CPR, and defibrillation. Healthcare providers, such as home health aides and CNAs, public safety personnel, such as police and firefighters, and others who might respond to a health emergency, such as lifeguards, personal trainers, and dental technicians, must learn the chains of survival and BLS so they can act quickly and correctly in emergency situations involving cardiac arrest.
So you never know where you're gonna be at, and something happens. So that's why it's important to know what to do. Even if you're just the person going to get the AED, or you're the person handling the AED, or whatever, it's important to know like each part so you can contribute to trying to be helpful to deliver high quality CPR and to make sure that you defibrillate. Because the defibrillation is important. After all these studies, all these cases, they figured out that doing high quality CPR, and that might just be chest compression. You don't have to do the breaths. I wouldn't do the breaths unless I'm in a facility where y'all have barrier devices, or you have an ambu bag or something where you can breathe with them. And then defibrillation, using the AED to try to get it to shock that abnormal heart rhythm that the patient is in. So it's important. So whatever field you go into, it's important to still know it. Even if you don't do medical, it's still important to know because you might have a family member that you might have to, do something for them. I was in church one day and the lady collapsed, and we was in church and we was praying and my head was down and I kept hearing nurse, nurse, and I look up because of course I'm not a nurse, so I wasn't responding. So I look up and they're looking at me and I'm like, it was a lady down, so I had to go up there. And my cousin goes to church, he's a respiratory therapist too. And then my husband, he's in the Air Force, but he's an EMT, so he came. So I mean, she wasn't like in cardiac arrest or anything, but we took her vitals and took her blood pressure and all this stuff. And then, they had called 911. So we were able to tell paramedics when they got there what was happening and all that stuff. So even if it might not be like, cardiac arrest, you still can be kind of helpful.
First link in the chain of survival. If a person is in the hospital and experiencing cardiac arrest, the first link in the chain of survival is early recognition and prevention. If a person is out of a hospital, activating the emergency response system by calling 911 is the first link. Recognizing the symptoms of cardiac arrest is crucial. These symptoms may indicate a person is in cardiac arrest. Unresponsive, not responding to touch or sound. Absence of normal breathing, not breathing, or is gasping unsuccessfully for breath. No circulation. Victim does not have a pulse.
So these are symptoms of cardiac arrest that you should know, so you should be able to recognize. So if somebody's unresponsive, so if somebody goes down, you're going to check your scene, you're going to walk up to them, and then you're going to tap them and say, oh, you're okay, you're okay. That is checking for unresponsiveness. So if they don't say anything, they hear you asking, are you okay, they don't move after you tap on them a little bit, then that means they're unresponsive. Then you're going to remember next, you're going to look for breathing. You're going to check for a pulse. While you're checking for a pulse, you're looking for breathing. So you're looking to see if they're breathing at all, if they're barely breathing, or they're not breathing. So if they are breathing normally, they could have just fell, hit their head or something, just collapsed. Now, if they're not breathing or if they're gasping, that means that you need to start CPR. If they're gasping. Gasping is not normal. Usually if they gasping, that means death is near. If they're breathing like that, or they're about to stop breathing completely, that's what that means. So that means you need to do something. So if you're checking for circulation, that's checking to see if they have a pulse. If they don't have a pulse, that means you need to do CPR. You need to do compressions. Now, if they have a pulse and they're just not breathing right, or they're not breathing at all, you just give them what's called rescue breaths, and we'll learn about that. However, you do not do chest compression on somebody that has a pulse. Which, if you got a pulse, you don't want nobody beating on your chest. So you need to make sure they don't have a pulse before you start pushing hard into the center of their chest.
Once a cardiac arrest victim has been identified and the emergency response system activated, it's important to start CPR immediately. CPR is short for cardiopulmonary resuscitation. Breaking down these words helps to provide a meaning for the phrase. Cardio means heart. Pulmonary means lungs. Resuscitation means to restore to life. Therefore, cardiopulmonary resuscitation means bringing the heart and lungs back to life. CPR, if done properly, can keep a critical amount of oxygenated blood flowing to vital organs, especially the brain.
All right, so those of you that took medical terminology, and we even talked about it in foundation. Cardio means heart, pulmonary means your lungs, and then resuscitation means you're going right. So that's what cardiopulmonary resuscitation means. You're trying to get them back alive. So if you do it correctly, if you do it like within a timely manner, you could be more successful. What does cardiopulmonary resuscitation mean? The last one, bringing the heart and lungs back to life.
CPR can be performed in 3 basic steps.
All right, so when you're talking about CPR, you got 3 steps. You got what's called CAB, that's circulation, that's your chest compressions, you got your airway, and then you got your breathing. Airway is making sure that you have your airway open, because if you're trying to give somebody breath, you gotta make sure that their airway is open. If not, then the breaths are not gonna be delivered into the lungs. So you're gonna do what's called a head tilt chin lift. we'll talk about it when we actually start doing CPR. And then you're gonna do either rescue breaths, give them breaths, like by themselves if they have a pulse. If not, you're gonna give them the breath with chest.
The circulation
Alright, so circulation is when the rescuer gives chest compressions on the victim's chest. Does anybody remember how many? It's not up there. Does anybody remember how many pumps you give? Pumps. Chest compression.
25.
Who?
25.
Go up. 30 compressions. So when you first start, you'll check, are you okay? Are you okay? No response. Check pulse. Y'all know the way to check the pulse that on an adult patient? Huh?
Yeah,
Where?
on the neck.
On the neck. What's it called?
Uh,
Card. Alright.
the carotid.
Carotid artery, which is in the neck. You're gonna check your carotid artery. While you're checking for carotid artery, what else are you looking for? You're checking for to see if they have a pulse and if they're breathing. So once you do that, then you're gonna call for an AED. So call 911, get an AED. Then the first thing you're gonna do is what? If they don't have a pulse, what's the first thing you need to start with?
Chest compression.
Chest compressions. So you'll do 30 compressions to how many breaths? 2 breaths. You do 30 compressions, give 2 breaths, 30 compressions, give 2 breaths. So that's how you start it. So you check for circulation, you're gonna check for breathing, and I'll have either call for AED, because the quicker you get the AED there, the quicker they're gonna set it up. And cause the AED is like a little machine that's gonna tell you, hey, we need to shop. You know what I'm saying? You don't have to put any kind of extra effort into it. It's gonna tell you what to do. But you gotta get it there and you gotta get it turned on. So the compressions, it squeezes the heart, forcing it to beat and pump blood. Because remember, if you're in cardiac arrest, your heart has stopped. Arresting means it's stopping. So it's stopping. So once the heart stops, there's no blood that's going through, and it's not going through the lungs, not going through the brain. That's why after so many minutes, everything starts to shut down. So you want to keep pumping. That's why that's the first thing you need to start doing. You want to try to get that heart to beat, and you want to get that blood to start going through the motions again. Because the blood carries oxygen to the body, to the brain. Sometimes, even if you don't do it, even if you do it correctly, a chest compression only pumps about 30% of the blood volume supplied by a normal beating heart. That's why chest compressions need to be given quickly and without interruption. So even when you're doing chest compressions, minimum interruptions. That's why you're only gonna do 2 breaths, because 2 breaths should not, if you give it 2 breaths, it shouldn't take more than 10 seconds. Interruption should be less than 10 seconds. This thing is haunted. This does what it wants to do. So that's why you gotta make sure you don't interrupt. Even when they bring the AED, you will you'll keep doing compressions. They're gonna have to work around you because you don't want to stop because you're trying to get their heart to start back pumping.
the circulation
Alright, so then
the airway
so
step.
then you have your airway. The airway step is when, after you do your 30 compressions, the rescuer opens the victim's airway by tilting the victim's head back. So when you tilt the head back, you're gonna lift the chin and open the mouth. So what this does, it lifts the tongue from over off the back of the throat, and that way that the air is going straight into the lungs where it needs to be, and not going other places like the stomach.
The breathing step is when the rescuer delivers.
So when you do your breaths, you give rescue breaths to the victim. So if you do them correctly, that's gonna fill the victim's lungs with air. The air contains oxygen that can be absorbed by blood in the lungs and delivered to the body during compression. So each breath that person inhales contains about 21% oxygen. So we call that room air. So when you have, we're just like us chilling right now, we're sitting here breathing, we're breathing 21% oxygen. If I were to give one of y'all put some oxygen on y'all, then that's gonna be more than 21%, depending on how much oxygen I put y'all on. So just sitting here chilling, we don't need any extra oxygen. We're breathing 21% oxygen, and we call it room air. Only about a quarter of the oxygen is used in the body. The remaining is exhaled. This means rescue breaths can contain about 16%, which is plenty of oxygen for a baby. So that's why the circulation, which is your chest compression, is the most important step, because without the heart pumping, nothing else is gonna work. So that's why it used to be how it says CAB. It used to be CBA. It used to be circulation, breathing, then airway. But they changed it because circulation, of course, still comes first. Open the airway, then you're gonna do the
If a cardiac arrest victim.
All right, so if the patient is in VFib or ventricular fibrillation, remember that's an arrhythmia, or the impulseless ventricular tachycardia, and that's PVT. So the best way to get the heart back to a normal rhythm. So remember, if your heart is pumping, which is what it's supposed to do, and your heart starts doing crazy stuff like getting really, really fast, or they're not doing what it's supposed to do, you use your AED to shock it. So the purpose of the AED is to shock it back to that nice, normal 80 to 100 beats per minute, not 250 or whatever the heart is doing like crazy stuff. So that's why we need to do an AED. That's why I need to use it. That's why it's important to, once you figure out that your patient doesn't have a pulse, your patient is not breathing, you call for help, you get somebody to go get the AED, you start the chest compressions or vice versa, and then as soon as the AED gets there, you're going to hook it up to the patient. So it says the defibrillator is a device that delivers an electrical shock to stun a heart in VF or PVT back into a normal rhythm. However, a defibrillator may not be immediately available. Therefore, CPR is used to prolong the time a victim can survive until a defibrillator is available. So you got to make sure somebody is getting one because you need it, but you still need to make sure you're doing CPR. BLS rescuers will typically use an AED or automatic external defibrillator. An AED provides voice instruction on how to use the device. So remember, it talks to you. I think some of y'all have seen it before. Like you turn it on, it'll start telling you what to do. This includes when to stop CPR and to allow for the device to check for a shockable rhythm, such as VF or PVT. Now, all cardiac situations have shockable rhythms. If the rhythm is shockable, the AED will tell the respirator to deliver a shock. So how the AED works, you'll turn it on, you'll attach the pads. Remember, it has pictures on it, and we'll look at all this when we get more into it. It has on, like when you open it, because it's dummy proof. That's why, like, as long as y'all got it, it's gonna tell you what to do. And remember, like, you hook it on the patient, and when it's time to analyze, so it's gonna analyze the heart rhythm every 2 minutes. So when it's time to analyze, it's gonna tell you it's gonna analyze the heart. You're still doing your CPR, and when it wants you to stop, it's gonna say, stop compressions or shock, deliver shock. So you can't deliver a shock if anybody's touching it. So it's analyzing. If it's shockable, meaning if it's in VFib, ventricular fibrillation, or pulseless VTAC, then it's going to shock. If it's in something like asystole, remember asystole is that flat line, it's not going to shock. Only thing you can do is CPR. It won't shock for asystole. And that's sometimes how you know that it's in asystole, because if it's not going to shock. Now, the ones at the hospital have the little monitors on it, and it'll show you what rhythm it's in. But if you're out somewhere, the AED doesn't have it. So it'll be like no shock detected, and then you just continue CPR. But if you can deliver a shock, it will. And it won't let you shock if it's not time to shock. So you can't just be pressing the shock button. It's not going to shock until it's time to shock. So that's a good thing about it. CPR can be performed in 3 basic steps. Which letters can be used to represent or remember these steps? CAB, circulation, airway, and breathing. All cardiac and arrest situations have shockable rhythms. Remember, asystole, flatline, it's not gonna let you shock it. It's not shockable.
While the general rule is.
Alright, there are a few situations where you should not initiate BLS. Like we said, the first thing you need to do is make sure your scene is safe. So if it's an insecure scene that can result in injury to you, like a fire, then mean, you don't need to be right up in no house trying to do CPR on somebody. That's burning.
Teachers and students, please excuse this brief interruption. Students, today I sent out a call out as well as an email and text messages through Blackboard in reference to Evening Academy. Evening Academy and night school is the same thing. It's going to be held from September 20th, from October 5th to December 16th. However, registration for night school is going to be held after school from 3 to 6 p.m. next Monday, Tuesday, Wednesday, and Thursday. The purpose of this announcement is to notify all students that we will be registering students for night school next Monday, Tuesday, Wednesday, and Thursday. That's going to be September 20th through the 23rd from 3 p.m. to 6 p.m. We're going to have the registration desk at the front of the school, and you're going to be able to ask questions about night school, aka Evening Academy. Now, students, here's an example of what Evening Academy will provide for you. It gives you the opportunity to graduate with your cohort. Your cohort is the class that you came in with during your 9th grade year. 4 years later, you should be walking across the stage. PA system, we're going to be saying your name, and your parents are going to be in the crowd cheering. If you want to graduate on time, I would suggest that you go to night school in order to get credit that you did not earn in a previous year. Some students didn't have the opportunity to go to summer school. Night school is your time to make it up. Some students are wearing yellow shirts, but on their schedule it says they're 10th grader because you may have one 10th grade class. So you can take your 11th grade class in night school and your 10th grade class in the day school, and you'll be a full 12th grader next year. I repeat, Evening Academy, aka night school, allows students to make up credit that they did not earn during a previous year. We're going to have registration next Monday, Tuesday, Wednesday, and Thursday. From 3 to 6 p.m. Students, it's imperative that you bring a parent or a guardian with you when you come to register. Thank you.
But some people just wasn't diligent enough to, virtual learning is not for everybody. It's hard. It's hard to do. I know, I got my master's degree online, and I was working night shift. I had Jordan. I got pregnant with Jordan like my first semester. I was like, oh, wow, this ain't gonna work. So after I got out, because it was just working night shift, being pregnant. I had gestational diabetes. Couldn't eat what I want. Blood sugar it'll be like 200 and it'll be 50 and I'll be sweating. And it was just, so I had to stop until I had her, then I went back and finished it. But it was just too much. So and plus, online is more work. It's more work. And I had a senior last year, and some of the kids was like, why she in class? And she told me, she was like, I can't do it at home. She was like, there's no way. She said, I'm not gonna do it at home. I said, at least you know. She knew she couldn't do it at home. So she would come. I'm like, you know what you can and can't do. Some people know they couldn't be at home and do it, because you gotta be disciplined. Y'all was sleeping at work and boyfriend talking over the thing. I'd be like, huh? And it was.
I tried to just go to another room.
Yeah.
Yeah.
But it was just, it's not for everybody. So, but I mean, summer school started before I left for the summer. So it was so many kids up here. But then when they found out that they wasn't doing ingenuity, a lot of them didn't come back. When you actually had to do like work, so a lot of them stopped. But they kids, but they was all now. They tell you they was all on this side looking in my room. I'm like, oh, I'm looking for. Oh, that's all the way in 9th grade. It was way over here. I'm still like, I want to fail some school though. My mom would have beat me, so I couldn't do the rest stuff. I didn't play. Alright, so Thursday we're going to get started with BLS to see how y'all arm muscles work. Y'all gonna do chest compressions. I'm so excited.
I have a great answer. 2 whole years.
What?
2 whole years.
2 years what?
Chest compression.
You ain't done them?
And 2 whole years.
Yup, it's time, it's time. I got to figure out because, I don't know, have y'all been on that My School Book?
Yes.
Does it have things on there?
Mm-hmm.
Whenever I log in, all I see is other schools. I don't see nothing that says Jeff Davis on there.
Yeah, you gotta type in the, well, no, you just gotta put the JV website.
I did. I tried the other day to see if they, because like we gave them a list of what like stuff we like. I would say HOSA and they put the fee and all that stuff, but I don't know if any of that's on there. Cause when I tried to look, I didn't see any of that stuff. Now I know when I use it for Jalen them, I just got an app on my phone. I just go in there and type what I need. And I just pay for it. I mean, I like it, but when I went on this one, I couldn't see anything. I didn't know if it's because I don't have a kid in the system, I can put nobody's name in or what. But
Probably, cause.
I know like their stuff like that have both their names, so both their schools pull up. So everything from both their schools, unless I just type in like something specific like junior fees, then it just pop up and I'll pay it. But like everything from both of their schools just pulls up, and I can scroll for days. But
Because I seen like they was like biology, and talking.
they had all that stuff on there. See, I can't see. That's what I'm trying
Probably
to
you don't
see.
have a kid restriction.
But I bought my t-shirt. One of them t-shirts on there. Oh, well, they had sent out a link. I just clicked that link and I just bought the t-shirts. But I'm gonna look again because I don't know what's all on there. Because people was asking me, I'm like, I can't even see nothing. I don't know. So I will see. So I need to disinfect my mannequin and all that stuff tomorrow. What is this? I'll send an email at the end of the day.
Don't forget about them beds too.
Who?
Them beds.
Oh, y'all ain't gonna use the bed yet. I haven't used anything though, like, because I have nobody in here. So I'll put y'all right in. Probably, I can probably throw y'all in before I leave, but I'll probably, grab study y'all when you're home. And, we'll start doing, oh, really?